My name is
dari
Laura.
bahasa ini.
I will be host in this
Ya.
studio event.
Kalau
First of all,
komik
we
terlalu
would
tua,
like to say thanks to
terlalu
Dean
tua.
Vice
Ketukannya
Dean
sudah mulai berubah.
Public Health Universitas Erlangga.
Kenapa?
Thank you also for Head of Department
Ya,
of
saya cuma
Epidemiology
menyarankan, Bu. Karena
for
ya Ibu
attending
pilih
this morning.
keselamatan apa pilih hari.
Thank you
Dengan
very
pilih
much
hari tapi
for the.
mengorbankan keselamatan janin.
So sorry, Dokter.
Senin. Lah iya, minggu pagi lah Senin. Oh, minggu pagi ini nanti. Jangan, Bu. Kalau minggu saya waktunya istirahat.
Bisa di mute dulu, Bu
Jangan
Laura.
pilih hari sih.
Ya.
Bisa nggak, Bu Laura,
Bu
melakukan
Laura
ini?
di mute all dulu, Bu Laura. Di mute all aja.
Saya nggak bisa.
Kalau host bisa.
Nggak bisa sih, co-hostnya siapa ya? Atau hostnya siapa?
Ya, kan tetap ke semua kan
Bentar. Bu Eni mungkin ya?
ternyata ketukannya sudah mulai berkurang.
Oke, coba saya masuk ke apa
Jadi,
itu? Saya keluar dulu ya, Bu. Saya masuk
boleh
sebagai host dulu.
tetap keselamatan
Iya.
itu nomor 1. Masalah weton dino itu semua hari baik. Gitu loh. Kan,
Ya.
kenapa?
Jadi yang
Saya tuh hari
yang
ini aja, Bu ya. Operasi saya itu
ada yang berperan untuk ini meng-off-kan mic-nya.
pagi-pagi sudah 1, nanti ini ada lagi 1. Terus ketemu. Makanya saya noto gitu loh, minggu saya istirahat, saya kerja lagi nanti Senin gitu loh.
Prof. We are waiting for managing the participant. Yeah, some of participant has not mute or turn off. Yeah.
Saya minta ini ya, bisa sekarang.
Oh, bisa ya.
Iya. Tapi di sini
Oh.
Gua nanti dirunding di sana ya.
Okay, I think so. Clear the voice. Okay, let we start our event today. Good morning, everyone. Welcome to our guest lecture held by Department of Epidemiology and Magister Program of Epidemiology, Faculty of Public Health, Universitas Erlangga. My name is Laura. I will be host in today's event. First of all, we would like to say thank you to Dean and Vice Dean, Faculty of Public Health, Universitas Erlangga, for attending this morning. Thank you also for the Head of Department of Epidemiology, Faculty of Public Health, Universitas Erlangga. Thank you so much for the participants, audience, our students, our college, and others who are joining today. Especially thank you so much for our distinguished speaker, Professor Chung Lee. He is a professor from National Chung University, Taiwan. Welcome, Prof. Lee. And thank you very much for your spare time on the weekend. Yeah, to share your knowledge and also your experience with us. Of course, we feel so sad because in this year, you cannot visit to our faculty and we cannot meet up each other physically, not like previous year because of the COVID-19 pandemic. But we hope that, this pandemic will be over soon and you can visit again to Indonesia and enjoy it so much. Before we start our agenda today, just the information. Previously, we provide the registration link to join today's event. We have collected the number of the participants registered, that is around 200%. And for the affiliation of the participant is various, not only from the Universitas Airlangga, but also from other universities, national and international, and also other institutions like they are from the district or city health office and also hospital in Indonesia and etc. And allow me to inform our agenda today. The first, there is the opening speech from Dean Faculty of Public Health, Universitas Airlangga, and also we please inform that since the 1st October 2020, we have a new dean elected. I think Professor Lee knows her very well. She is Bu Santi as our new dean. And for the second session, second agenda is the lecture delivered by Professor Chung with title Taiwan Strategy to Control COVID-19 Pandemic. I think this topic still has become a hot issue until to date. And the last session is open discussion. During the presentation, when the participants have the questions, you can write down in the chat room. We will collect all the questions and hope all the questions can be answered by the speaker. So now we go to the first agenda. Maybe Bu Santi wants to give opening statement for our agenda today. Please, Bu Santi, time is yours.
Okay, thank you very much, Bu Laura. Assalamualaikum warahmatullahi wabarakatuh. Good morning for everyone. Our distinguished lecturer Prof Lee, and our Excellency, our first dean, Prof Rika. Good morning, Prof Rika. And also, and also our the professor. I know that there is Prof Riri and also Prof Katrin as head of our study program, and also Bu Ati as head of Department of Epidemiology, and our partner from District Health Office, head of District Health Office, and also from hospital. I think there is maybe a representative or the head of the Sutomo Hospital, and also the head of task force from COVID-19 in East Java province. And also our respected participants. Good morning for you all, and thank you very much for your coming to join in this this lecture. I think this lecture is very important for us because from this lecture we can learn each other, and also we can learn from Taiwan, because we know as Taiwan the number of the cases is not many, I think, compared with our country, and also the number of death is also very small. So I think it's very important if we can learn from this lecture, and then we can we can get the lesson, and then we can formulate from this discussion and to propose and to the government either in regional or provincial and also in the national level. So we can contribute to our government, and we can contribute to our country to flatten the curve, and also to contain the pandemic. because this pandemic is already happened in our countries in more than 6 months, I think. Yeah. So the impact is not only to our health, but it's also to the non-health situation. So that's why I think this is our responsibility. It's not only the government responsibility, but it's the individual responsibility, I think, to involve or to contribute in containment this pandemic. Okay, once again, thank you very much, Prof. Lee, because this is the weekend, so you can provide your time to share with us today. I think it's we very appreciate for you. And also, once again, thank you very much for Prof. Rika, our first dean of public health, to always support us, yeah, in every our activity. Yeah, thank you very much, Prof. Rika. And also for, yeah, thank you very much, Prof. Yeah. Thank you very much also for the respected audience, yeah, for your
congratulations as a dean.
Yeah, yeah. Thank you. Okay, it's, I will give time. I will give back the time to you. To Bu Laura. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you
Maybe
very much.
Prof. Rika will give speech.
Okay.
Speech, Bu Rika, before we start.
Thank you.
Want to
Please start.
Yeah.
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 No,
Is
thank
it any that you want to deliver, Prof. Rika?
Deliver what?
Yeah, anything. Maybe you want to
To say something.
to say hello to the participant, because the participant maybe some of them it's alumni from Faculty of Public Health. Yeah.
Okay, okay. Thank you very much for this time that give to me. Okay. Good morning, all participants. Maybe you are alumni when I was dean in FKM UNER. But now you should know that there's a new dean here, Dr. Santi. Congratulations, Dr. Santi. I hope you will be
Thank you, Prof.
success and make FKM more, the civitas academica, I mean, will be more productive, and beneficial for the student and for the community at all, And I congratulate with this, what it is, guest lecture, That's why I want to join, so I'm not left behind you. Okay, thank you very much. Bye-bye.
Yeah, thank you, Prof.
Kok hilang? Kok hilang ya?
thank you very much for Susanti for the opening statement and also giving the point of view for our title today. And also thank you very much for Professor Rika for speech and also joining with us today. And we go to the next agenda. So we will start our main agenda, the lecture that will be delivered by the Professor Chung Yili. Before starting, allow me to introduce him, read his curriculum vitae briefly. He is a professor and lecturer in the Department of Public Health, National Chung University, and he got the bachelor degree from the National Taiwan University. and he also got a master's degree in the same university, and lately he got the PhD degree from the McGill University in Canada, and he expert in the field of environmental epidemiology and clinical epidemiology, and also health service research. And many publications he has related with the his expert. I think so many research he has. And okay, I will invite Professor Chung Yili to start the lecture. Please welcome to Professor Lee. I will give the time to you, please. Thank you very much.
Thank you. The introduction by Dr. Laura, and also the opening speech by Dr. Sandy, and also congratulations for the new jobs for Dr. Sandy to take the lead. I think that's a greater responsibility for you to work hard to improve all aspects in the College of Public Health there at Erlangen. It's my great pleasure, even though today is on Saturday, but I really appreciate everyone's coming to join these lectures. I already sent the slides that I'm going to present today to everyone, and I think you can download the slides on your site. I also sent 3 articles which are related to today's lectures, and you can also download it from the system, the Zooms. If you have any problems, then I will send it again if you have any problem with downloading it. So now I will share my screen and start with my talk today. Just want to make sure that if you can see the slide that I'm going to talk now.
Yes, Prof.
Okay.
Yes.
Okay. Thank you. So today I'm going to talk about the COVID-19 pandemic situation here in Taiwan and what we have been done since early January this year. And I have several parts I'm going to present. The first one is from the government side, the operational structure, and the government actually passed some laws specifically for these events. But I will put my lecture for the most part of my lectures on preventive strategy. Just like Dr. Sandy said, it's not only the responsibility of the government, it's the responsibility of everyone. Here in Taiwan, everybody is participants in the prevention of COVID-19. We do have some international cooperations, and I will talk about later. So this is the situation. I just got the Taiwan CDC yesterday. It's updated on October 2nd. We can see that now more than 1 million people die from COVID-19 around the world, and almost every country in the world affected by this pandemic. There's no doubt about that. So 34 million have been infected globally, and we know that the US President Donald Trump was confirmed infection yesterday. So it's not a disease only for the poor or for the general public. It's also for the people who are in the higher level positions. So it's really a problem. I think that's a very, very rare cases in human history. And on the right side is the numbers in Taiwan. Look at here, this is case fatality rate. Now globally, the case fatality rate is about 3%, which is much higher than the other pneumonia, like the flu-related pneumonia. The case fatality rate will be less than 1%. But now the COVID-19 have a very high case fatality rate, about almost 3%. Taiwan, so far, we have 517 confirmed cases, and 7 of them die. So we have about 1.35% of case fatality. I think this number is very low compared to other countries in the world. But I just want to emphasize that in Taiwan, we do not make a mass screening. So far we have only screened for COVID-19 among like 194,000. So it's really not a mass screen in Taiwan. We only screen for those who were reported to the Taiwan CDC. So it's the responsibility of the GP in the clinics, in the community. So they just know that someone has a fever, has a higher body temperature, and the GP will ask about the history, about the contact, the history of the traveling. So if the GP is suspicious about the potential cases of COVID-19, the GP will transfer reported these cases to the Taiwan CDC to go for further examinations. So the GP in the community in Taiwan plays a very important role in identifying the potential cases of COVID-19. So actually, we do not perform a mass screen. Taiwan has 23 million people. So far, we only screen for 194,000. So this is also one possibility why our confirmed cases, the number of confirmed cases is so low. We are worried about there is some potential unidentified cases in our community. I will talk about this later. So our first case was confirmed in January 21st. So here we have 3 colors. The gray colors are, most of the cases are imported from outside other countries, but they are Taiwanese. They are traveling to other countries, working or residing in other countries, and then came back. Most of them are from the US, Japan, Europe. So then when they came back, and most of them, I think that they already know that they have some symptoms. So they just want to come back to Taiwan to receive the treatment. You know, Taiwan has a free treatment, it's a free healthcare. So I think that most of the people are coming back just because they have symptoms. But they are Taiwanese, so we cannot reject, we cannot refuse them. We have to allow them to come to Taiwan. And only the orange color are the community acquired, the local cases. Compared to the number of imported, the local number is very low here. And there was an outbreak in the army. There is a warship, a Navy warship, just returned from the Republic of Palau. So I think it's like 30 or 40 soldiers, the sailors from the ship, they were infected. But so far we don't know whether or not they just infected, and then because they traveled to Palau for like 10 days and coming back. So probably it was infected by Palau or domestic, we don't know, but there are about 30 cases were reported on this event. So totally 507 cases confirmed and 7 of them died so far. This is the pictures I just take from the newspaper. It's Indonesia. And it states that now in Indonesia, you have more than 10,000 people die from COVID-19, and this the number of deaths is the highest in the Southeast Asia. And I know that it's a very difficult time for everyone in this year of 2020, not only here in Taiwan, but also in many parts of the world. So in Taiwan, we have operational structures. As I said, that Taiwan, we have like 2 million people are working and living in mainland China. It's accounted on about 1/10 of the total population of Taiwan. So we have very intense communication and traveling with mainland China. So on January 21st, the first cases were confirmed. It's a businesswoman working in China and returned to Taiwan for Chinese New Year. Chinese New Year is on January 30th. So when the first case was confirmed, everybody is worried about the situation because we know that in the Wuhan province, there are a lot of cases reported in the beginning. So many Taiwanese will come back for Chinese New Year by the end of January 30th. So when the first cases return from China, Wuhan, then we know that there will be a serious problem because more than 1 million people will travel back to Taiwan for Chinese New Year. And we have no idea how many of them have already infected. So on January 20th, the Taiwan CDC increased the level of epidemic command centers was established. The commander will be the chief, the director of the Taiwan CDC. But when the first case is confirmed, we know that there is a problem. So on January 23rd, the level 2 of CECC was established. And then the Minister of Health, Dr. Chen Shizhong, serves as a commander. This is a picture of Dr. Chen. He is a dentist. Then to the February 27th, the level 1 of CECC was established. The commander will be the premier of the government. But because the premier think that the Dr. Chen has been very successful over the past months, so still the Dr. Chen was the director, the chief of the CECC. The level 1 means that the director not only control the Ministry of Health, but also the other parts, the other minister of the cabinet. So because for the control strategy, the Ministry of Education, the Ministry of Economics, Ministry of National Defense, all parts of the cabinet must be get involved in the whole team to control this epidemic. So Dr. Chen, he is the Ministry of Health and Social Welfare, but he's still in charge of the entire government for this controls. So every day, Dr. Chen have a press meeting every day, talk about the progress, and some of the government officials and some of the researchers from universities, I think they are physicians of infectious diseases. So they just reported to the public in order to reduce the anxiety and the depression and the panic of the public. I think that's a very useful strategy for the government to tell the truth and the number of cases every day and what the government has been doing every day. Talking about the law, Taiwan has a Communicable Disease Control Act. So we categorize all the infectious disease into 5 categories. And those 5 categories means that the GP in the community, if you are suspicious about the possible communicable diseases, then the GP, the doctor in the community, must be reported to Taiwan CDC. So on January 15, the COVID-19 was listed on one of the diseases in category 5. This is the least important among the 5 categories. In other words, the GP in the community must report it, the possible cases of COVID-19 to the central government in order to go for further examinations. And government also passed a special act to do many parts related to this pandemic. Basically, I can divide it into 4 parts. The first one is the prevention. And the second one is the relief and the revitalization. That's for the economic loss. Because during the pandemic, I think the situation is the same in Indonesia. A lot of business have been damaged, like the tourism, the theater. Nobody will go to the supermarket. Nobody will go to the restaurant. Nobody will participate in the tour. Even especially, to go outside for the international traveling. So a lot of business have been damaged by this pandemic. So the government just spent a lot of money just trying to get a relief for the business. Of course, there's a penalty. So this special law also pose a very serious, tough penalty for the people who violate the control strategy by the government. This is the money spent for the prevention. So totally roughly 197 billion NT dollars, which is roughly equal to about divided by 30. So you may have like 6.5 billion US dollars. This amount of money was paid to the people who are in quarantine, because people who are in quarantine probably will terminate their jobs. So the government will pay them for 1,000 NT dollars per day, which is about 30 US dollars per day, and also pay for the hospitals. Well, during the pandemic period, many people just, they do not want to go to the hospitals. If they have some small problems, then will, to stay home, not to take risks to go to the hospitals. And also a lot of supplies like masks or this personal protection equipment. So the government just purchased a lot of supplies and to distribute to the public in order to prevent the spread of the virus. So that's the money spent for the prevention. And this is the money, is about 13.4 billion US dollars spent for the relief and the revitalizations. The tourists, the small and the medium enterprise, and also transportations. A lot of people just reduce the transportations. They just don't want travel. They don't want to take the metro. They don't want to take the train. So many transportation companies, they lose a lot of money. So the government just spent the money to get a relief to help those enterprise. Otherwise, those business probably will go for bankruptcy, and that will cause a more even greater problems, because if the business go bankruptcy, then a lot of people will get unemployed. The unemployment rate will increase. That will further cause negative impact on the economy. Then we'll go for the preventive strategies. So there's two parts here. The first one is smoke control. The second one is the community surveillance. Let's look at the timeline here. Since February 16th, the community surveillance system has been implemented. Just like I said, the GP plays a very important role. They have to report it to Taiwan CDC for anyone who are suspicious to be the potential cases of COVID-19. Then the Taiwan CDC will use the standard method to take the diagnosis. In the beginning, we have only 12 laboratories around the islands. The whole country, only 12 laboratories have this capacity. So we can examine only like 520 cases per day. But 2 months later, the number increased to 50 laboratories due to the supplies by the government. And we have a capacity of taking the test for 6,000 cases per day. So within a short period of time, the capacity of our laboratory diagnosis increased quite a lot. The ball control was the first step. Well, actually, if you came to Taiwan before, we have stations in airport since 2003. That's the SARS outbreak 17 years ago. So since then, we have temperature monitoring stations in the airports. So we just reinforce the fever screening for all arriving passengers. And if you are detected by higher body temperature, and the officials will go for interview about the travel history, occupation, who you have been contacting, and conducting health assessment. If the government official in the airport are suspicious of possible cases, they will report it to the Taiwan CDC to go for the further diagnosis. So as I said, we had the first case on January 21st. So on February 7th, all the passengers from China, Hong Kong, and Macau need to fill out a form to trying to early identification of the potential cases from China. And all the people from China, Hong Kong, and Macau must go for 14 days of quarantine. And 4 days later, they have to fill out a specific form about the coronavirus health declaration forms. On February 16th, we set up a very simple app. So you can just fill the forms on your apps, because as I said, a lot of people travel in between Taiwan and China. So if we are going to fill the form, then it will take a lot of time to get immigration. So this is the easy step for the people from mainland China. And on March 19th, all the foreign nationals have been prohibited from entering Taiwan. That's the very important and critical step. In other words, after March 19th, only Taiwanese citizens or people who have a permanent residence permissions can enter in Taiwan. In other words, it's isolated of Taiwan from other parts of the world. And 5 days later, even the transit, because there's a lot of airplane from the US and North American had a transit in Taipei and go for the country to the Southeast Asia. So since March 24th, the government imposed a further strict no any airplane or the transit of the airlines passengers can be allowed to stay, even though they're just only for the transit. So the border control has already been implemented in March. Then the government will focus on the preventive strategy for the community, because now nobody will be allowed to go into Taiwan. So we just want to make sure that the community is safe for all the Taiwanese residents. So there are several things. The first one is the home isolations. So people who contact with the confirmed cases, they must go for the 14 days home isolations. If people, they go for home isolations, they are not allowed to go outside. They must stay at home. If they go outside, they will get a penalty. So this is 1 million, not 100 million. Sorry, it's 1 million. It's 1 million NTD. It's roughly about 33,000 US dollars. It's a very big penalty. So some people just go outside and caught by the police. So actually, there are several people, several cases, or got this fine of 33,000 US dollars. Not everyone can stay at home. There must be some conditions. If you have a room, you must be stay there for the isolated room, and also that room must have sanitations. So in other words, if you do not have a appropriate form fit these conditions, they have to go to the hotel. The Tourist Bureau has provided the hotel for home quarantines. So you must stay in the hotel, and they will provide some compensation for you. People who go for the quarantine, they will get some compensation, like 33 US dollars per day. So because they are lose their freedom for temporary time. And also you always have your your cell phone open on. You cannot turn off your cell phone, because the government is trying to go into track your locations by using the GIS. So everyone is supposed to have only one cell phone. So you cannot put your cell phone at home and bring another cell phone to go outside. So the electronic security monitoring system was strictly imposed in monitoring those people who are in quarantine. Yeah, I think this is a very key steps for the success of home isolations, because the government will check the health. They will call you twice a day to see if you are okay, and if you have any symptoms, do you have any fever, any respiratory symptoms. And also, they know that they will detect someone living from the quarantine areas by using the GPS. So the response workers and the police will receive a message if your cell phone are leaving the quarantine locations. So they will check your personal locations immediately if they find that your cell phone is just leaving. So it's almost impossible for the people who go outside. If you just leave your cell phone at home, they will call you and to ask you to answer the phone. So there is a difference between home isolation and home quarantine, but the content is the same. The home isolation means if anyone who contact the confirmed cases, they must go for home isolation. The home quarantine means that people who are coming from other countries, they enter in Taiwan, they must go for home quarantine. But it's just different name and different people who take responsibility is the responsibility for the local health authority, and this is the local civil affairs bureau. So they are local government, but different authorities who are responsible for the people who are going for home isolations or home quarantine. But the content is the same, just like I said, 14 days. And then after 14 days, they must go for another 14 days, means self-health management. For the self-health management, they can go outside, but they must have some, they must follow some rules. For example, they cannot use a public transportation. They have to keep 1 meter away, and also they have to wear mask, medical mask all the time when they go outside. So totally, if a person will go for home isolation or home quarantine, totally they have to go 14 days, they cannot go outside, and another 14 days, so totally 28 days, almost 1 month. So that is a big loss of the freedom for anyone. And we know that a lot of people go for the home isolations because if you were known that you have a contact with the confirmed cases, so each cases probably have more than several hundred or even more people who have contact. Not only the persons who are knowing these cases. For example, if these confirmed cases go for a restaurant, all the workers, waiters in the restaurants must go for home isolations. So it's a very strict rules for the people who must go for the home isolations. The next one is the control of school and public places. For the schools, in the early February, actually, my university, National Chung University, was the first one. Our superintendent saying that we have to postpone our opening for 2 weeks. Then after the announcement from the president of the NCKU, the Ministry of Education of Taiwan, they just urged all the universities and high schools to postpone, delay opening the semesters for 2 weeks in early February. And we have to monitor the students' health conditions and the students and teachers' activities, we have to monitor it. So in other words, we are establishing a footsteps. I will show you the pictures later. So every time when you go into a new building, you have to scan your QR code, just knowing that where you are and which places or which buildings you have visited on the campus. Of course, the school will supply the medical supplies like myself, our department was in the hospitals, so we were supplied by 1 mask per day to make sure that all the workers, all the faculty, the students near the hospitals are safe. So this is the pictures for the elementary school. So the elementary school, the primary school teachers will, in the morning, they have to stay at the gate of the campus and to put some disinfection agents, which is 75% of alcohol, to all the kids. Some teachers have to measure the body temperature for all the kids who are going to enter in the campus. This is another bigger, because it's a small, I think it's a small one. So it's not many faculties are here, but this is, I think this is the bigger elementary schools. So they must be have several lines and a lot of teachers standing here, just make sure that all the kids entering the campus are without any symptoms. If they have any symptoms, then they are not allowed to go to inside the campus. They have been referred to the Taiwan CDC for further confirmed diagnosis. This is for the university. So university, the students they are adults. They don't need to. So here, only one person's here, and they have to write down their names and why you are going to the campus. Because for the university campus, everybody can go inside. There's no any regulation for the university campus. So you have to write down your purpose and why you have to go into the university campus. And inside the classes, all the students from the kindergarten to the high school, the junior high school, junior high school, this is senior high school, this is for the college students. All the students inside the class at different levels of classroom have to wear masks. Even now, we are still impose this rule. Actually, you will see our cases since June. There's very small number of cases reported in our community. But even though we now we are relatively safer, not many cases. But now we are just beginning the new semester. We started our semester on mid-June. So 3 weeks ago, we start the new semester, but we still, after the summer vacation, we still impose this rule to ask everyone have to wear the mask inside the campus. This is a special strategy for NCKU because those are the rules proposed by the Ministry of Education, but different school or different universities, they do have their own policies. Here at NCKU, we have some classes with more than 100 students. We are not allowed to have these courses. So if this classes has more than 100 students, then the university asks the e-learning, the remote learning. So the students do not need to come to the campus. And for the classes with a student number from 50 to 100, students have an option. You can choose either stay at home or you can attend the classes in person. It's up to the students. But the faculty, the professors have to teach in person in the classroom, but the students have the options. Then we have to check the body temperature at the campus gate. And actually at NCKU, we close a lot of gates. You know that for the university, normally there are a lot of gates that can enter in the campus from the different directions. But in order to reduce the possible problems, we just close a lot of gates and only allow several gates. And some gates we set up the infrared body temperature sensor to detect in the people with higher body temperature. Just like I will show you some pictures in the metro, in the train station, bus stations, we all have the IR body temperature sensors, just like in the airport. And also at NCKU, as I said, we have to scan QR code. Here, every classroom has a QR code. So when we enter in a classroom, this is my office. This is my office. I also have a QR code here. So when you go into the different classroom, different office, different buildings, you have just to scan the QR code. That's required. The purpose of this is to trace individuals' footprint in case if there is a confirmed case happen, the government will know where or when the confirmed case is traveling within the campus. The school authority will know the footsteps of the confirmed cases, which is very important. If we know that this confirmed cases has contact several people, those people with contact with confirmed case must be go for home isolations. So the scanning QR code is a daily routine for us. Well, sometimes we will forget, but the students or the faculty colleagues will remind us we have to scan the QR code every time when we go inside a room or a building. And also during the classroom at NCKU, we use a fixed seat for students. You cannot choose. Well, because we have to know who are sitting beside you. So all the students must have the fixed seat for the entire semester. If you are going to change your seat to sitting beside your good friends, fine, it's okay. You have to tell the teaching assistant saying that you are going to change your seats. Otherwise, you are not allowed to change your seats without telling anyone, because we just want to know that where you are and who are sitting beside you. And of course, at NCKU, just like many other universities, we request our students to wear a mask in class. Also the faculties, the professors who are talking in the classroom, we have to wear the mask. The control in the public health. Of course, many countries use the social distance for the outdoor activities and also for the indoors. The social distance in Taiwan was implemented on April. So we request that inside the house, at least 1.5 meters to keep the distance from others. And for the outdoors, keep 1 meter or more from others. So that's the maintaining social distance for with one strategy for control in public places. And also we set up several social distance rules. For example, if you are waiting into the mass, the train station, the MRT, the mass transportation systems, you put in the line, but you cannot close to, you are not supposed to have very close to the people who are in front of you. And also during the hospital, not all seats are variables. Those seats are just not allowed to use. Everyone has to have a seat, to have an interval here. So the hospital will put some sign here saying that this seat is not available at this time. And also in the supermarket, when you are in the line to buy something or to see the cashier, then you were not allowed to stand too close to each other. And always, for the public supermarket, always wear the mask. In the hospital, it's the same. So the government suggests that if you have any indoor activities, like in Taiwan, we do have a lot of concert. And also for the superstar, the senior, they have some performance, they have some indoor activities. The government just prohibit, they just ban all the indoor activity with people more than 100. And for the outdoor, if the activity is more than 500, which is prohibited. So nobody, no indoor activity with more than 100, no outdoor activity with more than 500 are allowed during this pandemic period. In the restaurant, you can see that we have glasses. We have glasses to separate all the seats. So this is the picture I just took from our hospital. And here is the scene that you can see during the lunchtime. the people just go to the restaurant to eat, and you can see that all the seats are isolated. So of course they can talk, but it's just separate from the people, just like this way. Actually, I'm just talking with my friends. So he has a cup of coffee and I have a cup of coffee, and we have a mask. Then when I talk to him, of course, there's no problems, but there is isolations for each single seat at the restaurant. And also, if you do not have the isolations, the restaurant is required to prohibit some seats, to make some seats are unavailable. Like here, you are not supposed to sit here. You cannot sit here. For these tables, normally there are 4 people can sit in one single table. But during this pandemic, only 2 people are allowed to sit here. Just keep the distance, not to sitting close for the lunch or for the dinner. And this is a train station. Here, everyone going to the train station, you have to go to the sensor. Here is the sensor, just like the airport. So here is, if you are higher than 35.5, you are not allowed to take the train. That's required, that is regulated by the law. So everyone, you cannot go, you have to go far, just follow the directions to go past the sensors. If you do not go this one, you want to go this way, then you will got a very severe penalty. You got a fine. So everybody must be follow the rule to go into the train stations. And this is another, is MRT, also in the station. Everybody has to wear mask. If you are not wearing mask, you are not allowed to go into the transportation system. Yeah, just go for one way. There's someone who are sitting here to monitoring the temperatures. If there are suspicious with the potential possible cases, then you will be asked to go for further examinations. And there's workers here. They use bleach to clean the facilities in the stations quite often. So during this period, where every time you go into the train stations, you always see the workers, cleaner. They are just clean those facilities inside the train quite often. This is just another picture. This for the high-speed rail. So all kinds of stations follow the same rules. Someone are sitting here, monitoring all the people are going to the train station. Okay, let's move to the prevention strategy for the healthcare systems. The hospital will be another source of potential cases, because we know that the infection, the in-hospital infection is sometimes a serious problem, especially during the outbreak of the pandemic. So now in Taiwan, we have 161 medical facilities collecting samples. And also we have 134 isolation hospitals to treat or confirm cases. So those cases were treated in another spaces, so they are isolated. We call the negative pressure patient rooms. So now all over the Taiwan, we have 134 hospitals who can provide this treatment for the confirmed cases. And if they are severe, they will be transferred to 55 regional hospitals or 20 medical centers, including 20 medical centers. In Taiwan, we have 20 tertiary medical centers. So those centers provide a higher level of treatment to treat for the people who are severe symptoms. So now it's the structures for the medical systems. Taiwan provides a national health insurance programs, which is free for treatment for anyone who are diagnosed with the COVID-19. Actually, we have the national health insurance programs since 1994. So it's more than 25 years ago. So everyone can receive a free treatment when they are have a disease. So this card is a very important one. This card recorded all the medical visits over the past 6 months. So you can go for any other clinics or hospitals, but when the doctor use your card, the doctors will know your medical history over the past 6 months. And during this pandemic period, this card also linked to your records in immigration. So the government, the doctors will know your traveling history by just looking at your card to insert in the machines. So if you have traveled to other countries last month or 5 months ago, the doctor will know, because some people would not tell the truth to the doctor. Because if they tell the doctor truth, saying that I'm go for the mainland China last month, probably the doctor will ask this person to go for the further diagnosis of the possible COVID-19 infections. But when the doctors using this card, they will know everything. They will know the patient's history of traveling. They will know the medical visit over the 6 months. So everyone going to the hospital, they have to show this card to the people. Just like this one. This is the medical staff in the hospitals. All the patients going to the hospitals must go for the check, your medical history and your traveling history, and you pass, they will give a stamp on your hand. Then you don't need to go for, again, if you go outside, you can go inside if you have this stamp for today. Another strategy is the personal equipment, personal infection prevention equipment. And this is, to be honest, if you ask me, what are the key elements for the success of control pandemic here in Taiwan, I would say personal equipment, which are face masks and 75% alcohol. Well, when the first case was confirmed, everybody get alert. So everybody just go for to buy the mask. So the drugstore just run out of the mask. No, you cannot, there's no mask available at the pharmacy or in the supermarket. You are not allowed. So the government decided to that only 3 masks that you can buy for each person. So you cannot buy a pack or even more. And beginning from February 6th, the citizen can use the card, just like I show you that everyone has a national health insurance card to buy masks. And there is a regulation. You can only buy 2 masks every 7 days. So in other words, you have to use your mask very carefully. You cannot just throw it away after 1 day. You have to use your mask like 3 days because you are allowed only 2 masks to buy every 7 days. So in order to avoid, many people just rush to one pharmacy. So the government asked, because everyone in Taiwan, we have ID number. So if you have ID number is even, you have to buy your mask on Sunday, Tuesday, Thursday, and Saturday. And you have your number end with an odd number, then you can buy on Monday, Wednesday, Friday. On Sunday, everyone can buy mask. So this strategy is trying to ask people not to go for one single pharmacy to buy the mask, because the pharmacy is the only place that you can buy the mask. So this is just the national health insurance card. You have to use your national insurance card and your ID card, because your ID card will show your ID number. So every time you have to bring the 2 cards to buy a mask, 2 masks per week. So this is our daily morning. you will see no matter it's a hot day, it's a rainy day, people just line up to buy the mask. Here you can see that no matter your kids, your older people, your adults. Myself, I always to buy the mask on the line and to go to the pharmacy to buy the line. And the government just provide the app. This app showing that because sometimes when you are in the line, but when you go into the pharmacist will tell you that we are running out of the mask. We don't have mask available. So the government just give a map here. I'm living here, so I know where I can buy the mask because they will show you how many masks, the adults mask, the children's mask are available. And then you can just drive or you can ride your motorcycle to go other, and you can see that here the red one is running out of the mask, no mask available, and the green one shows there is a mask available. So you can just to here, if you are living here, then you can go here to buy. But sometimes if you are not fortunate enough, then you go there. The pharmacist will say that, oh, you're not lucky because we're just running out 5 minutes ago, because this is not always simultaneously. There is a time lag because they have to send this message to the Taiwan CDC and they will show the numbers on the map. But it's good. I mean, you don't need to go for each individual pharmacy, and you can go for the pharmacy that have still a lot of masks available. That will save you a lot of time. So all the masks were regulated by the government. The post office will send the mask, and also the mask cannot be exported. I do not show you here. Government, they can, the government from the January, government has banned on the exportations of medical masks. So all the local manufacturers cannot export the mask. All the masks must be used locally, domestically, cannot be exported to other countries. So the government control the mask and send the mask to individual pharmacy. So the pharmacists are very, very busy. They in addition to the refill of the medication, because they have a very heavy loading during the pandemic. Patients don't want to go to hospital, so they just refill their medication at the pharmacy. And the pharmacists also have a responsibility to distribute the masks. So the pharmacists are very, very busy during this pandemic disease. And I think that the pharmacists are also plays a very, very important role in the control strategy. Here is the pharmacist. She has to, to answer all the questions raised by the public. And some public are worried about, they are angry. Why I spent 2 hours on the line? Then you are telling me that your mask is just running out of the number. You don't have the mask. So they just blame the pharmacist, saying that, well, you should tell me earlier. Well, so we can understand that people, stay in the line for much time and then just cannot get the mask. So the pharmacists in the distribution of masks just have very heavy burdens. So beginning from the March 5th, the government just, because our local manufacturer, they can produce even more the mask. So we can buy 3 masks per week. So it's easier for us to buy. And beginning from March 25th, we can purchase the mask online. You can order online. That will be easier. You don't need to in person to on the line. So you can just order it online. And if you successfully order the mask, and then you can go to the pharmacy at any time just to pick up your mask. So after March, it's a big relief for the people to get the mask. So you can use your apps to order your mask and to see whether or not you have already successfully got your mask. And also you can pick up your mask at convenience store. So many convenience stores like to distribute the mask, because if you go to the convenience store, probably they will get some promotions for coffee or other things. So this is also a big relief for the pharmacists, because before we can order the mask online, the pharmacy is the only place that we can, because we have to use our car, and the convenience store has not no such systems. Only the pharmacist can use your national health insurance card. So after March, it's a big relief for the pharmacy, because you can pick up your mask at any convenience stores. That would be a big relief for the pharmacist. And then the manufacturers in Taiwan, they can produce even more masks. So now we can have 9 masks every 2 weeks. So it's not a problem now, because you can also go for the pharmacist to get your mask, and but you can order online. So beginning from June, the mask can be delivered, go outside without any limits. Before this, the mask cannot be exported outside to other countries. If you have your family, your friends living in other countries, before June, you are not allowed to send the mask to your family. But after June 1st, there is no any limitation, because I think that the government knows that the number of masks are just quite enough, more than enough. So now there's no, this is not a problem for the mask distribution at this moment. In the beginning, the 75% alcohol is the same, because everyone wants to have a 75% alcohol to clean their furniture, they clean their door, they clean their hands. So it's really also only can be available from the pharmacy. So the pharmacists have the responsibility to distribute. And this alcohol, 75% alcohol, is also controlled by the government. You cannot get the alcohol from other places. The only place that you can get is the pharmacist. So far, we're still stocking up enough personal protection equipment, the mask or the 75% alcohol, in order to protect everyone from COVID-19 infections. Now, we have a lot of different masks, different colors and different flowers. And for the young ladies, they are just don't want to use, they just choose the different colors. And the government also, the government officials are also starting to export our mask to other countries who are in need. So actually the mask is now not a serious problem here. Everybody can easily get the mask, as many as you want. The health education and improved health literacy is another thing. So the Central Academic Command Center, the ECCC, held a daily press, as I said, chaired by the commander to release the information to the public. So they also get a lot of posts about health educations, how to maintain the social distance, and how to go to school, what you have to notice about things that you're going to school. And also they held the daily, so still so far, every day at about 13 or 14 in the PM, the government will hold a conference, a press, to tell people how many cases we have today and what have we been doing so far to prevent the controls, to control the pandemics. And also ask people to wear the mask when you go to the hospital. If you have any symptoms, you have to wear the mask and go to the GP first. And for the elderly people, or those who have poor immunities, always wear your mask. So if you are healthy and if you are going to go outside for outdoor activities, then you don't need to wear a mask. So health education, I think, is another thing, not only for the post, but also for the YouTube. The government just made a lot of short, like 2 minutes or 3 minutes YouTube movies to tell people how to clean your hands. Here, before you eating things, before you hold the baby, after you use the toilet, and after you have your nose, and then before and after you see your doctors, you always have to clean your hands. So a lot of things and education are posted throughout all different media. So, well, actually in Taiwan now, if you're watching TV, it's a lot of education programs are released from the government, and you are always seeing a lot of messages telling that what you should do and what you should not do in order to reduce the chance of being infections. Yeah, this is this is the government official, the director for Taiwan FDA. So you can see that a lot of doctors and government officials teach you how to wear a mask and how to go to hospitals. Yeah, a lot of things. How to go to the restaurant. If you decide to go to restaurant, what you should be aware of and what you should do if you decide to go to the restaurant. So the government still think that the public should always be very careful and be well aware of many things in order to reduce the chance of being infected, even though the number of cases in our community is not so high. As I said, that the mask, many countries during the pandemic, they are just running out of the mask. So beginning from June, Taiwan still started to export the mask to other countries, to the US and to many European nations. So this is, I just cut the pictures from, this is from the Dutch. And this, this is from Dutch, is to the German. This is to the German. So because for the people from the Europe or the from the US, they don't think that the mask is important things in preventing the COVID-19, but our experience is that this is a very important one. So when we have a lot of sufficient number of masks, we started to export. Of course, we will change some information from other countries to share some information. As you say that, as you know that Taiwan is not a member state in the UN, so actually it's very difficult for us to get the information from WHO because we are not a member state of the UN, so we are not a member in the WHO. So every time we want to get the information from WHO, we always have to get that information through the US because Taiwan has a very close relationship with the US. So we got the information from the US, not directly from the WHO. So in the early January, when we know that there are some cases reported in Wuhan city in mainland China, actually we sent our request to WHO to request more information about the situation and the case numbers in Wuhan, China, but we got no response from WHO. They just want us to go directly to the mainland China, but you know that we do not have very good relationship with mainland China, so it's almost impossible for us to get information. But through other countries, and we share some information, also got the information from WHO. Okay, that's my conclusion. If you ask me what are the key strategies, we did a lot of things, but I would say that there are 3 things which are very important to make the success of our strategy. The first one is application of the big data. As I said, we have a national health insurance card, and this card recorded many informations. although that's a confidential, I mean, it's a personal information, it should be kept confidential. But during this pandemic period, you must be choose between the personal information security or the confidentiality and the public safety. So the big data here in Taiwan, I think is very important role. I will give you one example about how we use the big data to control the potential epidemic. The second one is that we have a very good organization and the functioning of the community GP and the pharmacists, especially for the pharmacists. I mentioned to you that the pharmacists are tremendous. They are just doing a very great job. Well, GP are also very helpful. I mean, GP are standing on the first line to screen the possible cases of COVID-19. So the pharmacists, they distribute the mask, and also they provide the services of medication refill. So the patients do not need to go to the hospital. They just have the order and then go to the pharmacy to get the refill. And the third key element is the SARS, which can be traced back to 17 years ago. I will show you that the Taiwan pays a big price during the SARS. So most people in Taiwan, we know how serious an outbreak can be. So we just take some precautions measures. So the first one is the paper that I just gave you. If you are interested, you can see this is a case study in the Taiwan's big data. Those 627 patients who have contact with the travelers from the Diamond Princess cruise ship who were diagnosed confirmed cases. So how can we identify those 627, 386 persons? They are local Taiwanese, and they are then all go for the home isolations because they are potentially have contact with the confirmed cases. This is the a story here. There is a ship who were landed at the harbor of Keelung City in Taiwan for 1 day. And this crew has 3,000 passengers. They just stay in Keelung City and the nearby areas for only 1 day. They get off the cruise and then on board again. So finally, we know that the Diamond Princess cruise, this is a cruise owned by Hong Kong company. So we know that there is a cases was confirmed on January 20th, but these cases has traveled. This is the map here. I'll show you. This is Keelung City in the north part of Taiwan. And those 3,000 passengers, they just leave the cruise and they take the metro, take the buses, take the taxis. They just travel all areas here. So we can track because we have mobile phone base stations. We know how many people they contact and we know that where they are going. So we have the footsteps of the 3,000 passengers who are just paid several days, 1 day visit to Keelung City. And later we know that 1 passengers were confirmed as COVID-19 cases. So we just use the big data. We just use the big data to identify the people who are also traveling in these areas. They are probably the residents or they are doing business in this area, or they're just living in other places and they just coincidence to travel to these areas. So it's very easy for Taiwan government to identify totally there are 627,000 persons who probably have contact with the confirmed cases. So the message will send to the cell phone of all 627 and 387 cases, and then ask them to go for home isolations. They are not allowed to go outside for 14 days. So that's the strategy that we're using. The mobile phone positioning systems, and we have the GPS in the bus. So all the passengers, we know that where they go. So we have a travel guide. We have the transaction of credit card. This is also big data. We know that during the bank, the vending machine, the ATM, where they spend their money, where they which shop or which store that the passengers are visit. So we know that the route of all the 3,000 passengers. Of course, we have a camera. The camera is everywhere in Taiwan. Big streets, small street. I think this is for the prevention of the crime or the prevention of the vehicle accident, because Taiwan is very small and a lot of people. So we have a lot of crash, the vehicle crash. So every time we have a vehicle crash, so we need to have a camera in order to see who are responsible for the vehicle crash. So we have a camera everywhere. Of course, we have the ETC, which is the highway, the freeway, the highway. So every time when you have a bus, you have a taxi, you go the highway, then we know that which car or which taxi, which buses are going for which superhighway. So actually, all the systems can be interlinked. So it's easy for us to know where you are and who are the potential persons that you are contacting. So we can easily identify the people who should be go for home isolations. That is one example. And send that message to your cell phone. Saying that, okay, you are potentially have contact with confirmed cases. Then please go for 14 days of isolations. You cannot say no. You have to go because that is the law. The second paper I just sent you is about published just recently in the Annals of Internal Medicine. Professor O Huangzi, she is my colleague from the clinical pharmaceutical departments here at NCKU. Professor O, she is a pharmacist. So she said that she has to write down the role of community pharmacists in Taiwan and they are fighting against the coronavirus. So as I said, that the community pharmacists are playing very, very important role on the distribution of the mask and also for the educations. And so far, Taiwan, we have 6,515 pharmacists who have contract with the National Health Insurance. So they can have your National Health Insurance card to know everything about your history and about your medication over the 6 months. They repack because the government send the mask to the pharmacy. They have to repack because like here, we can only purchase 9 masks every 2 weeks. So they have to repack and then provide the service for the mask distribution. The pharmacists have to provide the education for the patients who have a lot of different kinds of questions. So the pharmacists in the community really plays a very, very important role in this control strategy. Because of that, you can see that in Taiwan, all the public places, these are the train station, and it's the platform of the train station. Here is the metro, it's the metro station, and the people sitting in the metro. Here is the campus. This is college student inside the classroom. So everywhere, everybody are wearing the masks. So that's the reason why I think that the masks are a key success. And it won't be so successful without the help of pharmacists. The pharmacists and the pharmacy in the community really plays a very important role here. The last one I would say is the SARS outbreak back to 2003. I know that during the SARS, Indonesia is not a big problem, but I will just want to show you that in year of 2003, only like 2 months, beginning from April 15 to June 4th, within only 2 months, we have a lot of cases being confirmed by SARS. And most of the SARS cases are also from mainland China in the beginning. So look at here, within only 2 months, we have 668 total in Taiwan. This number is greater than the number of COVID-19 this year. But we have only 2 months here. And among them, 181 died. Because no one knows what that is. What is SARS about? No treatment, nobody knows the SARS virus. And we know that in the SARS outbreak, there are several healthcare workers, including 3 doctors, 4 nurses, and 10 other healthcare workers. They were dead during the SARS outbreak. It's a very sad because the doctors are supposed to do the treatment to help the people, but they have no, they don't know what they should do because nobody knows what the SARS virus are. So everybody just get pandemic. During the two, we just heard that some people were diagnosed with SARS, and maybe 1 day or 2 days later, we know that the patients were dead. So the case fatality will be like 30% or even higher. You know, during the SARS, because we don't know what's going on for this SARS, there are several hospitals were closed without any warning. All the patients, all the doctors, all the nurses are just being isolated within the hospital. Those are the nurses or the healthcare workers, and they just want to tell the press, the media, saying that let us out. The government are not supposed to close the hospitals because those healthcare workers and the patients there were not allowed to go outside. The government will send the meals, all the other things inside the hospital, but they cannot go out. Some nurses are trying to jump out from the hospital because they have family, they have kids. This is the first nurse who died during the SARS. Who is a nurse? She has a mother of 2 kids, very young kids. So it's very sad. I mean, during the 2 months period of SARS outbreak, we have no idea what's going on. And the healthcare worker and the patients being shut down, closed, isolated inside the hospitals. They always want to media to know that how difficult they are when they're staying in the hospitals. So if you are interested in the lesson that we learned, actually after the SARS outbreak in 2003, the government set up a lot of strategy. For example, we do not have the doctors or physicians who are the government employee because of the salary. I mean, no doctors or no physicians want to become a government employees, because the government can only pay a limited number of salaries. And almost all the doctors or physicians, they just want to go for the hospitals. But after the SARS, we changed our policy. The government can pay more to the doctors, but the doctor had to stay in the government system to do we call the preventive doctors. They have to be responsible for this outbreak. Not only for the SARS, because in Taiwan we have dengue fever, we have tuberculosis, we have many other kinds of infectious disease. And we really need some doctors who get involved in the prevention and the follow-up of the systems. So after the SARS outbreak, we sent more than 100 doctors to the US CDC to get a 1-year training and to come back to become the government employees. And this year, my personal view is that those doctors plays a very, very important roles in preventing COVID-19 this year. And also we have systems like the hospital has to set up the capacity for the wards for this kind of unknown infectious disease. So we have our hospital capacity, and also just like I showed you the pictures, we have our temperature sensoring system in the airport, in the harbor. So those treasures are all set up after the SARS, because we know that it could be a very serious outbreak, just like the SARS. So probably because of we have experience and we learn a lot from the SARS, and just like I said in the beginning, we pay a big price. So everybody in this year, in the early January, when we know that there are confirmed cases from Wuhan, and nobody knows what are the infectious, people say that they are SARS again. In the early January, we don't know what are the cases in Wuhan. We all know that there are some strange cases reported from Wuhan, but we don't know it is a COVID-19. And people say that it probably be SARS again. So in the early January, the people in Taiwan get alert. The government get alert. Everyone get alert. We are just very worried about another outbreak again. Just like I said, we have 2 million people living in mainland China, doing business, study there. So a lot of communication, a lot of traveling between Taiwan and mainland China. Think that we have only 23 million, and we have 2 million people living in China. And this year, the January 30th are the Chinese New Year. So many people will come back from mainland China back to Taiwan for the Chinese New Year. So everyone in Taiwan just get alert saying that probably we will face another outbreak, because we know there is strange disease reported in Wuhan city in mainland China. So because of we have a lesson, we learned something from our painful experience during the SARS outbreak in 2003. So we get earlier. That I think is also another key element for the success for the control COVID-19 for Taiwan this year. Well, despite that, we're so far so good, but we still have some concern because we do not perform a mass screening. So we're worried about probably we will have some cases which are not identified in our community. And this is a Changhua County in the central part of Taiwan. The director of central, the Changhua County, the director of the Health Bureau of Changhua County, the Dr. Ye, he is interested in, so he conduct a small scale study here, because when the people are go for home isolations, several people will contact those patients. For example, the Health Bureau must send someone to send a meal to the people who are under the home isolations, and the medical workers have to go to the home isolations to check their health status, and other prevention workers. In other words, from until June to between June and August 2012 this year, in the Changhua County, there are 18 confirmed cases. And those confirmed cases have contacted nearly 5,000 people, including medical workers and other prevention workers from the health bureaus. So they just take the sample. Well, actually, those 4,800 people, they are not supposed to take the test, because they do not directly contact the confirmed case. They just indirectly to contact the confirmed cases. And the Dr. Ye just take the sample, blood sample from those 4,841, and they do find out actually there is some positive rate, but it's small. It's 8.3 out of 10,000. So in other words, there are several cases, among them are test positive, but they do not have symptoms. They just have a positive result for the virus, but they do not have symptoms. So in other words, in the communities of Taiwan, we believe that there are some people who are in the community been infected by the virus, but they just do not have symptoms. If the people do not have symptoms, they do not need to go for the further diagnosis. So this is unidentified the positive rates. And also, we have explored some cases. So here is the numbers here. Well, a lot of people are working, living, studying in Taiwan, including the people of Philippines, Japan, China, Vietnam, Thailand, Malaysia, Laos. Those are, especially the Philippines. A lot of Philippine people from Philippines are working in Taiwan. And beginning from over the past several months, like from June to September, those totally 38 confirmed cases, they were out from Taiwan. In other words, they were not identified as cases in Taiwan because they are in a community, they do not have symptoms, but when they go back to their own countries, for example, there are 25 people from Philippines, they were diagnosed as confirmed cases when they returned to Philippines, either in the airport or in the community of Philippines. In other words, those 25 people who were confirmed cases in Philippines, they were not considered as cases in Taiwan because we do not have mass screen programs in Taiwan. We only screen those who have history of traveling and who has also symptoms. So those are probably the identified cases in Taiwan's community. But one thing is for sure is those people do not show any symptoms about respiratory or the fevers. And the number become more and more. So the government now is worrying about why there are a lot of cases in September when they are going back to their country where they're from, and then they were confirmed as cases. The latest two will be the one from Japan. The other one is from 18 from Philippines. You can see that they just come to Taiwan and go back to Japan was diagnosed as COVID-19. And also from Philippines, the 18, they were totally from October 19 to 19, less than 1 month. Totally 18 workers back to Philippines, they were all diagnosed as COVID-19 positive, but they do not have any symptoms. So this is the potential problems for Taiwan, because so now the government is still considering whether or not we'll change our strategies to screen more people to identify the possible potential cases of COVID-19. Okay, so that's everything that I'm going to present, and I appreciate your listening. And I would like to take your comments and the question if I'm not clear enough in my presentation. Thank you very much. Okay, well, a lot of questions here.
Oh.
So
Okay.
where we should start, Dr. Laura?
Yeah, okay. Thank you very much, Professor Lee, for your nice and comprehensive explanation related with the Taiwan strategy to control of COVID-19 pandemic. I think the control strategy in Taiwan is very, very good because especially for monitoring a system for people in Taiwan,
there is the electronic monitoring system, right?
Yeah.
Using the cell phone for checking the health body in people of Taiwan, very frequently, yeah, until twice a day, and nobody cannot refuse the calling from the government.
Otherwise, they will get a very serious penalty.
Yeah, and also there is the GPS for monitoring.
Yes.
And also there is the QR code. Yeah, handprint in some public places.
Yes.
Yeah, public places to trace the individual in case there is the confirmed cases, right?
Yes.
I think, very, very good. And there is the strict border control to save the people in Taiwan, even prevent imported transmission and also eventually a local transmission. And I think also interesting, wearing masks for the people in Taiwan is already implemented in the beginning of the pandemic.
Yes.
And the mask is a primary needs, yeah, and high awareness of the people to wear masks in the pandemic situation. And government also manage availability of the masks through the pharmacy. And I think the quality of the masks is also considered by the government. Okay, we enter to the last session. Yeah, we will open to discuss. Some participants have already written the question. We have many questions, Professor.
Yeah. So.
Yeah, I think they are interested so much with your topic today. Hopefully, we can read all questions to get your feedback from Professor.
Yeah. Okay. Most of the comments are about the role of the GP and the pharmacists. And the GPs and the pharmacists in the community, I think that they are just tremendous. They are so great. The control strategy will not be successful without the contribution of GP and the pharmacists in the community. That's to be honest, I have to say that. So we have to give a lot of credit to the GP and the pharmacists, especially pharmacists. Because the pharmacists in Taiwan, they do not get high pay, unlike the GP. GP probably they will get a higher pay, but the pharmacists, they just double or triple their working load over the past several months. Normally they only have to have some medication refill, but during this pandemic period, they have to do a lot of things in addition to the medication refill. So I think the pharmacists are great. So the people tend to ignore health protocol. Yeah, another thing is the health literacy. I know that just like in the beginning, Dr. Sandy said that this is not only the responsibility of the government, it's a responsibility of everyone. Let's say that the wear mask. Well, when you are taking the bus or taking the train, if you do not wear the mask, they would refuse to transport you. So they can refuse to transport. But as far as I know, when I take the metro or when I take the train, there's almost everyone. It's not. I think that's everybody knows that this is important. So government do not need to do more to persuade the people to wear the mask. So that's I think that's everybody is aware of how important wearing the mask is. So it's really a personal belief. Just like the U.S. president, personally, I don't know that Donald Trump doesn't believe that the mask, using mask, is so effective. And for me, I think that the wearing mask is so effective. That's also one possible explanation for why we're still no many confirmed cases. Just like I said, we would say that there are some identified cases in our community because they do not have symptoms. And probably they have some capability to infect people if they are talking to people. But because everyone wears masks, so those identified cases, probably they have low capability of transmission. And the people who speaking to those people are also wearing masks. So the both sides are wearing masks. So the infection, the risk of infection will be very, very low. So that's my view is also one possible explanation why the confirmed cases in Taiwan, even though we know that there are some unidentified cases in our community.
Okay.
Let me see whether or not we have other questions.
Can I read one question? I think this is the interesting question, Professor.
Sure.
Okay. The question from the student: there is the trend of increasing case of COVID infection in Indonesia, especially last 1 to 2 months.
Yes.
Do you have any suggestion how to cope or tackle, and manage the situation to decrease the incidence of cases?
Well, it's a big question because I know all the preventive strategy must be taken into consideration the culture and the level of health education of the people. So I'm not sure what's the reason why there is a rapid increase in the number of cases of COVID-19 in Indonesia over the past several months. But if I can guess, I would say that people just do not pay much attention on these things, just like in the US. People do not pay much attention on the potential threat by COVID-19. So if people are paying attention, they got alert, they would change some behaviors. For example, they will less go to the restaurant. They will cook at home. They don't want to go to the restaurant. They don't want to take the transportation system. They will reduce their communication with people who go outside. Also, wearing mask is another thing. So the lifestyle will be the key element. I mean, if you want to reduce the number of cases in Indonesia, everybody must do something to change their lifestyle in order to reduce the possible chain of infection. Because this kind of COVID-19 infection is so strange. It's not only happened in the cold weather, it's also happened to the warm weather. But I did analysis, but it's still under review. In the early March, I just examined the cases of pneumonia. The pneumonia caused by the flu, because every winter in Taiwan we have a flu-related pneumonia, and those are the endemic disease. Every winter we have several hundred or several thousand cases of pneumonia because of the flu. But you know, in this March, the epidemic curve for the flu-related pneumonia is changed. There's the number of pneumonia dropped quite a lot. Only for those very old people, they have infected by the pneumonia, the flu. And I'm curious about why the flu-related pneumonia dropped so sharply during the March or April. And then I realized that's because the change of the lifestyle. It's not because the flu, because everybody knows that the flu is normal. Every winter has a flu. But in the February and the March, because of the COVID-19, everybody changed the lifestyle. They do not go to the hospital. They do not go to the restaurant. They just keep a distance. They don't want to go outside with their friends. So everybody changed the lifestyle. And because of they want to get rid of the COVID-19, but at the same time, they get rid of the pneumonia, the flu-related pneumonia. So we don't need to do, to do much more things. We just change a lot lifestyles, and it really can substantially reduce the chance of the COVID-19. That's what I believe. And there is also a paper published in JAMA, also not from Taiwan, from Japan. They are observing the same phenomena. During the COVID-19 outbreak, the flu-related pneumonia also decreased. The number of flu-related pneumonia also dropped sharply. So that's because you change your lifestyles and wear a mask and keep distance with somebody else. It really help. That's what I can imagine.
Yeah, thank you very much, Professor. I think one reason is because the people, Indonesian people, do not obey to wear masks, Professor, because changing of the lifestyle for Indonesian is quite hard, especially for wearing masks and also physical distancing and etc. Thank you, Prof. And for the
there is a UTT.
Pardon?
There is a question about the politics.
Oh, politics. Okay, the question.
Yeah, what are the status of Taiwan where there are issues not recognized by the UN and WHO? Yeah, just as I said, we're not a member state of the UN, so we were unable to get the information directly from the WHO, but we can get the information through the US. That's what we have been doing for over the past several decades. Because only the UN, the US will give us the information. No, I don't. Not many countries in the world will be willing to share the information with us. That's the problem of politics. And also the problem is also the population density. I think the Indonesia, I don't, as far as I know, you have a very crowded populations. And
yes.
This is also another problem, yeah. Like in I did not show you the distribution of cases. We have like nearly 600 cases. Most of the cases are from the city of Taipei. Well, of course, they have more people there. Like in Tainan, in the city of Tainan that I'm living, we have only like 15 cases. It's very, very small number. And most of the cases, I think more than 60% or 70% of the cases are from city of Taipei. And the population size of Taipei is just about 2 times greater than the city of Tainan. Tainan has a population only half of the Taipei city. We have 2 million, and Taipei has 4 million. But in terms of the case number, Tainan has only like 15, but Taipei has like 300 or 350. So the population density, I think, is also another key issue.
Yeah.
So that's really important to not to get people get together. So I think the policy for the University of Erlangga or other universities in Indonesia is right to still keep the e-learning, the distance learning. I think that's also a good strategy. Like in NCKU here, we just cannot have the class greater than 100 people. Any classes with more than 100 people have to go for the e-learning. So we cannot attend other courses in person. And more than 50, between 50 and 100, the students have options. They can choose to come to the university or they can learn from home. So that's one strategy to avoid too many people getting together.
Okay. Thank you. As information, we have over 200 million for the population, Indonesian population.
Yeah.
So big.
Yeah, so big.
Yeah, so big. Okay. Okay, can I read another question? I think this is
Sure.
also interesting.
This is about the school.
Okay. Yeah, regarding the school reopening policy, is it implemented equally across the region or proportionally according to the risk level of the particular area?
Yeah. Well, the Ministry of Education in the central government, they have set some regulations, like you have to take the body temperature when you student gather in the gate, and also they set some criteria like the students must wear mask inside the classroom. But that is just a general regulations. Different university will set up the different regulations, just like the question raised, because the different university or different high school, they face different challenges. In Taiwan, we have elementary school like more than 5,000 students, and for some primary school have only like 300 students. So different schools, not only colleges, but also primary school, high school, because they have different problems. So they set up the different criteria, just like NCKU. I just mentioned that the government, the Ministry of Education do not set any criteria about the class size. It's the NCKU. We said that if you have a class more than 100 people, then you should not go the in-class teaching. You have to go for the e-learning. That's the regulation set by NCKU, not by the Ministry of Education. And also the QR code. The QR code is not set by every campus. It's also by NCKU. Because when I travel to another university in Taipei, Taipei Medical University, they set the QR code for the buildings, but not for the classroom. So, and also some universities do not set the criteria for the fixed seats for the students. But here at NCKU, we have seats for the students. So different university or different high school probably will have a different policy, or depends on the potential problem they are facing. So it's not really because the Ministry of Education, they can only set some general rule for the schools, but they cannot go specific rule for each individual student, because each individual university or high school or elementary school, they have different problems.
Okay, thank you, Professor. We will give the opportunity for the participants who are asking directly to Professor Lee.
May I, Bu Laura?
Okay. Dr. Ato, please.
Okay. Good morning, Professor Lee.
Good morning.
It's very nice to meet you, and it's very nice to hear your very, very specific lecture, just like what I know your lecture when you visit Surabaya. It's very comprehensive, very long, and very detailed.
Thank you.
And very, full of spirit. So, correct me if I'm wrong, but in my opinion, I think the most important factors influencing the compliance of Taiwanese using PPE, especially face mask, is the experience of SARS pandemic. Because if I compare with Indonesia, for example, we never faced the same pandemic. SARS never happened in Indonesia. But and second, when I was in Taipei, I visited Taipei in 2009, and there was avian influenza pandemic there in that time. So everybody I see in the public places, in the street, in the MRT, they were wearing mask 100%. So that's amazed me. That amazed me, really. So I think the pandemic, the SARS pandemic, influenced so much to the compliance of the people of Taiwan, because right now 44% of Indonesian people don't believe in COVID-19. So that's why I assume that's why the compliance of the Indonesian people is low. So would you mind to share your thought and your experience? Thank you.
Thank you, Dr. Atok. I fully agree with your comments. Just like in the very beginning in the US and in Canada or in most Western nations, their belief is that only the people who are sick should wear mask. If you are healthy, you don't need to wear mask. That's the belief for most Western nations, from people from North America or from Europe. So only those people who are sick should wear mask. But this is a different philosophy in Taiwan or in most, like in Japan or in Korea. We feel that not only those people who are sick should wear masks, those people who are healthy should also wear masks. So that's an entirely different philosophy. Probably SARS is one element, but think about this. SARS also attacked Canada and West California in the US in 2003. But they still don't believe that the mask is important for preventing the virus spread. So it's really a culture related, just like Donald Trump. He doesn't believe that mask is necessary to prevent. So as you said, Dr. Atok, you were talking that the people in Indonesia, a higher proportion of them don't believe that the COVID-19 is a serious problem. If you do not take things seriously, then you would not pay much attention on it. That's the philosophy and the problems. I would like to point out that I missed one point. Well, actually in Taiwan, even without outbreak, even without the flu, even it's just in the normal period, I would say that more than 30 or almost half of the people wear masks. It's not for the virus, it's for the air pollution. So just like myself, I ride the, I normally I ride the motorcycle from my home to NCKU because I don't like to drive. It's not easy to find a parking space inside the campus. I like to ride the motorcycle. And when you are riding the scooter and you exposed to the outside, so I always wear a mask, not for the virus, but for the PM2.5, 2.5, is for the air pollutants. So the air pollution is a serious environmental problem here in Taiwan. So even during the good weather, the air pollution is still a problem. So the people in Taiwan wearing masks is quite common, and the people know that wearing mask has a multiple purpose, not only for the virus, but also for the air pollution. And also for when you, because Taiwan in the city of Taipei is so crowded, so when you take the MRT or the buses, a lot of people are so crowded. So some people just don't want to, to share the breath, share the air with someone else. So they like to wear the mask when they are taking the MRT or taking the bus or taking the train. So there are multiple purposes. So in other words, wearing mask is a commonplace for the people living in Taiwan or even in, especially in Taipei. That is also another problem. So why Taiwanese are so get used to wear masks, and not specifically for the virus, but for the other purposes. Yeah, but I agree with Dr. Atok. I think that you are right. If you do not think that the COVID-19 is a serious problem, then you won't be able to pay enough attention to it. Thank you.
Thank you, Prof. I always interest your explanation. And you say about the air pollution in Taiwan, even though in my thought, I think the air pollution in Indonesia is many times worse than that, because last time I went to Taipei, the air is very clear to me.
Really?
Okay, thank you, Prof.
Probably because just after the rain. If it is just after rain, then the sky is clear. The air is good.
Okay, thank you very much, Professor and Dr. Ato. We invite again for the participants who are asking directly to Professor, please. Is there anyone who wants to? Okay. Okay, if there is no the question directly, can I read one more? I think this is the last question, Professor Lee. Is it
Yes.
okay?
Sure, no problem.
Okay. Yeah, I think this is the interesting. Is the COVID pandemic in Indonesia still long? Yeah. And is the COVID pandemic in Indonesia still long time? Because in March 2020, the first COVID cases was found in Indonesia, and after 6 months, the number of cases per day was still high, and Indonesia still do not meet the how to say the peak yet. So what your suggestion for this situation?
So do you have any idea about the peak, when the peak comes?
Quite hard for Indonesia.
Hard to predict.
Yeah. I think maybe Dr. Ato or Dr. Ati can help. Because
the question, to read the
about
question?
the peak,
When
the peak, when Indonesia can
peak,
reach
in Indonesia.
The peak in Indonesia.
When?
Well, I'm not so sure anymore, actually, because we have so many predictions in the past, but we still face many, the social mobilization events that, involve many crowd. So, yeah. And one more thing that we can be sure about the peak of the pandemic is because our data is not valid. So our testing ratio until now is far below the minimum standard. Yeah, it's about maybe 53% below WHO standard. So we don't test the optimum number yet until now. So I think our cases now is not the actual cases. So in our opinion, we can predict the valid and precise prediction without valid data. I think that's what make us uncertain and unsure about it. Yeah.
Can I ask you about the distribution of the cases in Indonesia? are most cases are from the big city or from the countryside?
Well, mostly from the big city,
From the big cities.
yeah, in Jakarta and Surabaya. But now it tends to it tends to be distributed to like a more remote area.
Yeah, if most of cases are from big cities, just like Taiwan, probably the education is not the key issue. I mean, probably it's because the short distance contact, because of crowding of the populations. But of course, health education is another issue. But in terms of the health literacy, I would say people from countryside have a lower health literacy. But if the problem is in the big cities, then probably would take some measures about the social distancing or the wear masks. Is the number of masks, medical masks, sufficient in Indonesia now? Is it easy to get?
Currently, I think it is sufficient. So we can get easily actually in many markets. But
that will be fine.
Yeah, but people choose more prefer like unstandardized mask because it is cheaper and easier to get.
The quality is another problem.
Yeah, that's the two things. The third factors is that our social mobility is very high. We have so many social and ritual mobility, like if you can imagine like a Thanksgiving in America, we have like Idul Fitri, Idul Adha, or our religion holiday, that so many people from the bigger city move to the smaller city, and it's in the massive amount. So I think they bring the disease and spread it to like a more wider area. Yeah. Because our government, in my opinion, have no strict and regulation about to to restrict or to minimize the social mobility. They move as usual, like there is no pandemic at all. Yeah, that's my opinion.
Okay, thank you.
Okay. Okay, thank you very much, Professor Lee and Dr. Ato. Yeah. Hopefully Indonesia can study much, from the effort in Taiwan strategy to control the COVID-19 pandemic. Especially Indonesia can use 2 marks, for the activity outside. And because we have the limited time, we cannot read one by one the question in the chat room. So we hope the explanation from the Professor Lee can cover all
Sure. I will read the chat room.
All question from the participants. Now that we have come to the end of this event, we inform to the participants do not forget to fill in the attendance list in the chat rooms to get the e-certificate letter. We would like to express many thanks to Professor Lee for today's lecture and nice discussion related with the Taiwan strategy to control COVID-19 pandemic. We are really hope that this topic can give more insight and meaningful for the participant here. And also for the participant, thank you very much to join with us today. Okay, thank you.
Thank you, Dr. Lauer. Thank you, everyone.
Thank you. Bye-bye.
Thank you. Bye.
Thank you, Prof. Lee.
Thank you. Bye-bye.
Thank you, Prof.
Thank you for everyone.
Nice to meet you.
Very much.
Yeah, thank you, Dr. Laura, Dr. Santi,
Yeah,
and
sama-sama.
all participants.
Yeah.